In developing an intervention that addresses gestational diabetes, particularly in rural areas, research is quick to highlight the number of health disparities that affect the women in these regions. Indeed, as an objective of the Healthy People 2020 initiative, maternal health remains a topic of concern in this country, as disproportionate numbers along racial and rural lines feel the effects of the continuing exodus of resources, forcing many to go without adequate services. Fertility rates have been negatively impacted as understaffed, poorly equipped medical facilities cannot accommodate the needs of the population, often due to budget cuts, but also the ever-increasing cost of healthcare in general. There is often the unfortunate fact that many of the women and children that use the services in these areas are reliant upon Medicaid, which does not reimburse providers to the same degree other insurance often does. This creates barriers to care for these women and children in already challenging circumstances that are difficult to overcome without intervention. Gestational diabetes mellitus is elevated blood glucose levels during pregnancy that usually resolves after giving birth. Many of the predisposing factors for gestational diabetes include a lack of knowledge on the condition, a lack of motivation, creating anxiety and fear about gestational diabetes, and poor self-care management. Women in rural Alabama are particularly subject to the enabling factors of diminished access to care. This greatly inhibits the opportunities for intervention as there is less contact between caregiver and mother-to-be. These missed opportunities only add to the negative enabling factors of low income and limited education, leading to lower life expectancy rates. The reinforcing factors examined for this program to motivate change include the judgment some mothers feel from medical staff and an overall lack of understanding of their diagnosis. With better trained personnel, more education on gestational diabetes, and the development of a local support group, we intend to mitigate these factors. The goals of the program to reduce the rates of gestational diabetes in rural Alabama and increase the education on the condition include the process objective of connecting women with gestational diabetes with qualified OBGYNs that specialize in high-risk pregnancies. Our impact objective includes an increase in uncomplicated deliveries despite a gestational diabetes diagnosis, and a goal of 80% of our participants to remain in contact for continued support. Our outcome objective is that there will be a decrease by half in the cases of severe gestational diabetes complications in rural Alabama, with the goal of a program expansion of 10% each year and the ultimate goal of the development of a nationwide program. Our process objective is to make contact and record the starting A1C levels for 75% of the eligible women within the first 15 days of the program start. The impact objective is to lower the A1C of our participants by increasing education and home visits. Our outcome objective includes program staff making at least one home visit for follow-up with patients that have increased need and maintain observation for 1 year. A goal of this program is to reduce the number of gestational diabetics and increase the resources in this region of Alabama. Our process objective includes beginning health and nutrition services in the last trimester for participants. Our impact objective is that from the last trimester on, at least 75% of participants will see better control of their blood glucose with a 2-day checkup, and 80% will have improved access to health care. Our outcome objective here includes a pay-it-forward objective with our participants taking the self-care skills and nutrition information and volunteering to teach some of these same skills to their peers in this region of Alabama at an increase of 20% every year. A goal of this health initiative is to establish support for rural communities with quality health care for mothers and children, as Alabama has one of the highest rates of infant mortality in the region. This program hopes to better address the educational needs of this rural area and reduce the health disparities here. Our process objective holds that within 6 months of the program start, we will see an increase in obstetricians in this region by providing financial incentives. Our impact objective is by program's end, we will see an increased awareness of the racial disparities, increased access to prenatal care, and a reduction in infant mortality rates. Our outcome objective is that by the end of 2020, we will see a decrease in the infant mortality rate to 6 deaths per 1,000 live births. The first line item is the location, which has a budget of $5,000. This $5,000 is to reserve and pay for the location of our classes, which is going to be in the hospital recreation room. The next and most expensive line item is the personnel. This $50,000 budget will go to paying for the healthcare professionals who will be supporting the groups being run by teaching the participants. The next line item is supplies, which has a budget of $5,000. This line item is pricey, but is essential to making sure that the participants understand and write down the information that they need. Skill development would include giving the participants tools in which they could use in the home environment in order to practice what is learned in the workshop. The cost of skill development would be $20,000. A computer and projector will need to be purchased for presentation purposes so the participants have a visual marker to focus on. $3,000 is allocated to the promotion of the project. This is important because if people do not know about it, the turnout will be low. Lastly is incentives. These are going to include things that will make it easier for the participants to get to our events and encourage them to keep coming. It will be things like gas cards, bus fare, food, and drinks.
For our audience to understand what is being said, it is important that we use effective communication skills. So in order to make sure that the information is being communicated effectively, we will make sure to speak slowly and clearly. We will also make sure to simplify complicated medical terminology. We're not going to go in sounding like a textbook because most people don't understand a textbook. We need to keep it as simple as possible so they don't feel intimidated by the information that they are receiving. We will also be an active and effective listener, so we will make sure to listen to their concerns, any questions that they have, which kind of goes into our next point, which is give ample opportunities for questions to be asked, because the point of this is to make sure that they are gaining understanding, and if there are any areas in which they don't understand anything, they need to feel comfortable to ask questions. And lastly, we're going to make sure to build trust and confidence through communication. We will increase the likelihood for compliance. And that's when people feel comfortable and feel like they're being heard, they're not feeling like they're stupid or that they're being talked down upon, which is something that we touch on, they will be more likely to comply and apply what they've learned in our sessions.
And it includes need assessment and process evaluation. For need assessment, the program assists each participant to develop a routine on monitoring their hemoglobin A1C each day and report it to the healthcare center. The networking-like focus groups for each participant will help them to release their pressure and also avoid the postpartum depression in the future. The nursing care provides the counseling service for each participant. For the equity of healthcare, the volunteers and program personnel will provide the home visit or the pickup service for each participant. The program will meet the goal of providing the pregnancy and related education on gestational diabetes in rural Alabama by holding the nutrition workshop, and develop the habit of daily hemoglobin A1C check. The trust development between patient and healthcare workers, the connection between each participant and focus group member will help them support each other in emotionally and spiritually. The program will invite more champion and partnership to invest, such as Alabama Public Health, Alabama Diabetes Program to involve, in order to have comprehensive monitoring on each participant's health data. It is important to collaborate with local hospital and clinic to share the big data confidentially. Semantic evaluation is a process of evaluating the short-term and long-term changes for the program. From the impact aspect, the self-care technique and nutrition knowledge will be developed in each participant, and each participant will have the ability to teach others. From the goal of this program, the rate of gestational diabetes in Alabama will decrease when the needs engaged. The program provided equity for each participant to access to healthcare services. From the outcome, the long-term and persistent care of monitoring hemoglobin A1C for each participant decreased the risk of gestational diabetes and its complication. From the education strategy, each participant acquired the knowledge of nutrition on maternal health and friendship connection from the support groups, as well as self-management on lifestyle and hemoglobin A1C monitoring. For behavior theory's part, applied to stages of change model, we all agree the participants are all aware of maternal health and want to get control within 6 months, and the action stage of stages of change model is planned to change behavior for 6 months or less. Where we have 6 month intervention and follow-up in the future, the focus group can help each participant to change their behaviors by group members supporting or nursing teaching and help. For educational part, the teach-back method can enhance each participant's behaviors and responsibility on checking their blood sugar in routine and make a habit for that in the future. The workshop is extend each participant's knowledge on nutritional and importance of hemoglobin A1C check.
Our recommendations include support statewide efforts of the Alabama Perinatal Quality Collaborative, collaborative measures with the Alabama Rural Health Association, assisting rural Alabama hospitals with sustaining healthcare models and innovative technology, promote state initiative offering financial incentives to rural healthcare providers of rural obstetrics and reproductive care, loan repayment program incentives for graduates of UAB obstetrics and gynecology residency programs, requiring practice in rural locations for the time span of the residency. Improve financial revenue of Alabama rural hospitals by working to increase Medicare reimbursement rates by increasing performance rates.